It's Charles Barkley with Wayfair. It's outdoor season, and my patio set up better be ready to play. That's where Wayfair wins. Patio seating, umbrellas, and grills, all delivered fast and easy. Shop wayfair.ca now.
Wayfair, every style, every home.
Fully charged and ready to roll. The Elias Macco Show, CJAD 800.
Third hour of the Elias Macco Show. Still much more ahead as we wrap up the week on this program. Listen, I'm getting the COVID-19 numbers. They just came in, and I'll give them to you today. 2,203 new cases. That's a drop from yesterday. But, of course, that number, not so accurate because not everyone can get a PCR test. There are 12 new deaths being reported by the Quebec government. Hospitalizations are down by 14 to 1,048. People in the ICU, 59 people in intensive care. That's an increase of 2 compared to the previous day. 8,000 doses of COVID-19 vaccine administered. Those are the top-of-line numbers coming in this morning. Let's move things along here. As we approach 1 month since the invasion of Ukraine, Justin Trudeau has promised to speed up the visa process for refugee claimants from the country. Many of those fleeing the conflict are children. Now, how do we best care for them when they arrive? To find out more, let's go to the Montreal Children's Hospital. That's where we find Dr. Cecile Rousseau, a pediatric psychiatrist. Dr. Rousseau, welcome to the show.
Good morning.
So let's talk about this, the specific needs here when we talk about children who are fleeing from a war zone and now in a completely new country. What are the challenges that presents you and your fellow team members at the Montreal Children's Hospital?
Yes, I think that it's important to see that we're not yet receiving big numbers of children, but one of the challenges is about numbers, because what children in war first need is safety, physical safety, emotional safety, a house, a school, and you see all of that is kind of meeting their basic needs. And when you have, and we remember the Syrian exodus, thousands of kids and family coming in at the same time, they're often the basic needs that they take time to meet. So what I hear from community organization now, and especially La Table de Concertation for Refugee and Migrants, is that they're ready. We've learned a lot from the Syrian exodus and experience, so people are ready to welcome the refugees, both in schools, in communities, and of course there will be health and mental health needs, but you see this group of refugees will have access to Medicare, which is, I think, fantastic and will help us to help them because they will have access to our whole health system.
You're the director of the Transcultural Research and Intervention Team. You mentioned the experience and I guess the knowledge we have based on Syrian refugees that have come to Quebec. So let's talk a little bit more about that. Just how equipped we are because of our previous experience in this.
Yes, I think that we do know that refugee families, so they are, and there is a kind of a language barrier. And that's very important. So we do need a lot of interpreters, and we need to train those interpreters. And I know that this is already being done with the hiring of Ukrainian and Russian interpreters because we need to communicate with the family and with the children. That's, of course, beyond the Montreal Children's Hospital. That's community organization and hospitals and schools within Quebec. So that's, I think, our first lesson, having interpreters and training these interpreters because they may face difficult psychological reality. It's difficult for interpreters who are personally involved emotionally with the conflict because they may have family there or memories there to hear hard stories, so terrible stories day after day. So preparing interpreters is very important. The second thing is we learned that it's very important to prepare and give tools to schools. In that case, especially if you plan to resettle the refugee outside of Montreal, which is used to have a very diverse school clientele. Still, school board needs refreshment, and teachers in welcoming classes need an update on how do you talk, what do you expect, from kids coming from Ukraine, because Ukraine is not Syria. The conflict has been acute, very rapid. The exodus has been kind of massive. So you have effect of acute stress with the fact that most men have stayed back in the country to fight. And this is a big issue. So it's not only about the hardship of the journey, but about the worries that you may have for dad, for grandpa, for the brother who stayed back in the country to fight. So it should be defined as acute stress, acute ongoing stress. So on one hand, things are positive because I think position of Canadian public opinion toward the Ukrainians is very favorable, and they have a lot of support here. They may face less racism and discrimination than, for example, the Syrian exodus. Mm-hmm. On the other hand, the risk, because you have a lot of the family who are separated and father who are, in fact, in danger, in life danger, well, this is and can make things more difficult for kids to resettle because the stress is not over.
We're with Dr. Cecile Rousseau, pediatric psychiatrist at the Montreal Children's Hospital, talking about some of the challenges that lie ahead for children coming from Ukraine that will be arriving in Montreal. Dr. Rousseau, on that front, have any of these children already arrived? Have you already started to work with children from Ukraine?
Anecdotally, I've heard that a couple of them have, so a few people have arrived in Canada. For the moment, it's not concretized as a reality in our services. So numbers are to come, but we are ready and we're certainly preparing to adjust to this new reality.
Dr. Rousseau, let's just talk a little bit, because you mentioned before, these children coming to a new country, and there's a new language, and there's all of these hurdles that lie ahead of them. I had another guest on the program yesterday who mentioned to me that a full 1 in 5 of Ukrainians are fluent in English. So some of these people that are coming here know English quite well. They're not being allowed to go to school in English, despite the fact that they would be way more comfortable. What do you think about that? Is that something, should the Quebec government have a bit more of a heart when it comes to access to English schooling for someone who maybe has knowledge of English, a child that has knowledge of English?
As you know, this is a huge hot potato in Quebec. What I think, which is very important, is that parents and families should be allowed to express themselves in the language they are comfortable. And I think the fact that a lot of these families know English is very good news, because it means the need for interpreter within schools and within health services would be less. Mm-hmm. I do concur with you that we should make things as comfortable as possible for people to resettle there. And one of the delicate issues in what you're mentioning is that we need the majority of people to feel they're welcome and to feel they're not threatened by the refugees. Mm-hmm. So language should be addressed, and as you know, it's just very, very sensitive here. But I do agree that we should bend to the comfort of the refugee family and children.
Dr. Cecile Rousseau is a pediatric psychiatrist at the Montreal Children's Hospital. I wish you good luck in the challenges that lie ahead for you and your team. Thanks so much for coming on the show.
Thank you. Bye-bye.